So I have a background in pharmacology, and that's what my PhD is in. I also have a master's in public health as well. I utilize these two educational academic programs that I entered into to get into the field of drugs and designing them. I have worked in a lot of different areas, so broad range with designing drugs towards triple negative breast cancer, metastatic ovarian cancer, prostate cancer, testicular cancer, and looking at just not the chemotherapeutic design of aspects of drugs, but also in the field of diagnostics. So radiodiagnostics, working on small molecule for targeting. So that way we can identify cancer cells earlier, a little small colony sooner, and that way we can give a therapeutic regime that would work quite rapidly for these patients, so that the earlier the diagnosis that we give and the quicker we give those treatments, we get an increase in survival rate. I also have the public health side that I look at for pharmacology type mechanisms and protocols that are used in hospitals, and a lot of different things dealing with patient safety. So I really got interested in drugs and devices early in my academic career. I wanted to come up with new medicines that were safer, meaning less side effects, and that were more specific for the treatment at a cellular level. And so I really got into this idea of trying to optimize patient safety and optimize patient treatment regimes to help get them a earlier diagnosis, an earlier treatment option, and actually a more successful treatment option so that they could have a more optimal quality of life. What excites me most are when I see somebody that is working on a publication or a project that's in the field of drugs or devices that really takes a leap and a bound in this field. So I think of two terms, one is safety and the other one is efficacy. Dealing with safety, so patient safety, is that drug going to work better? Dealing with getting rid of side effects. Is it going to be safer and easier for the patient to use? In the case of efficacy, is it going to provide a better treatment option for that patient to help cure them of the disease or really get that disease handled so that they can have a good quality of life? So when I look at the field, I want to see things that are really nicely packaged for a patient, whether it's an innovation in the field, whether it's looking at safety margins for the patient's lives, and whether it provides a better treatment option for the patient. I think the journal medicine can really shape the future of the fields of drug and devices, because we look at a broad range of manuscripts. We're not just a specialty area type journal. We will accept any type of project, any type of research that is done in the field of drug and devices, so that can be across various disciplines. And so with this journal having that scope or that perspective, we really bring a lot of scientists together and get them to look at a lot of different projects and get them to really think about different areas that they can then apply to their expertise and really bring a lot of different fields and integrate them together. So anyone that's considered publishing in the journal medicine, it's really, you just jump in feet first. We look for good quality manuscripts, meaning you've got a really good project design, you have a good hypothesis, you follow that hypothesis on through for the project, you've designed the appropriate experiments for the project that you're interested in, you've analyzed those results appropriately, and then you follow through with a good discussion section on how the work that you did applies to your field. So really, when you consider applying to this journal for your manuscript, it's really just follow the basics. Just make sure you've got a solid project idea and you've done the appropriate experiments towards that project, and you basically analyze them appropriately. And then if you feel like you've done that, go ahead and apply, and we'll see how we do with the reviewers. And a lot of times the reviewers do give really good feedback that help you expand your project in a new direction for the future. For early career scientists, my suggestion is to submit as many manuscripts as you possibly can. And that is because you get feedback from reviewers and from editors, and you get comments and critiques that help you to mold your project, make it better, design new experiments for future projects, and really gives you this skill set on how to apply to a journal for submitting a manuscript, and what the structure of your manuscript should be, and how you can then take those critiques effectively and rewrite or revise your manuscript. So it's really, you will build a lot of skills the more that you submit a manuscript to a journal. For my area of drugs and devices, we offer great benefits to any author that's submitting their work, because we look at a broad spectrum or a broad scope of projects. And so we are very accepting of all different areas. What I will also say is it's great to submit a manuscript to our journal because we do have a quick review process. And so we can get you feedback very, very quickly. And so a timely manner for any project and any publication is always important, whether you need to revamp that project or revise that manuscript. And so getting that feedback is really, really good to have it very quickly. We also are indexed in PubMed, so that way you get your manuscript out to a wide breadth of individuals that might be interested in it. And it's a very quick and very positive review process that we use in our journal with our reviewers.